Ozempic. Complete review from a patient's perspective. Have you heard of Ozempic? Or better yet, have you tried it? Ozempic is the latest weight loss trend in the US, and it's getting a lot of attention. Let us learn more about what Ozempic is and how it helps with weight loss. How to properly use an Ozempic injection. User reviews of Ozempic. What are side effects of Ozempic injection? How to deal with those side effects? And what to do if you stop taking Ozempic. So what is Ozempic and how it helps with weight loss?
Ozempic is a prescription medication that belongs to a class of medications called GLP-1 receptor agonists. It is used along with diet and exercise to lower blood sugar levels in adults with type 2 diabetes and may reduce the risk of heart attack or stroke in adults with type 2 diabetes who have known heart disease. This injection works by helping to restore your body's proper response to insulin. Insulin is a hormone made by the pancreas that helps your body convert sugar from food into energy. In weight loss, Ozempic injection helps to curb your appetite, which leads to less food intake, and your body begins to burn the extra stored carbohydrates and fats in your body to create energy. It also decreases the production of glucagon, a hormone that produces carbohydrates in the liver. So by reducing your appetite and food intake, your body starts to convert the stored carbohydrates and fats into energy, and you lose weight day by day.
How to use Ozempic injection properly.
Ozempic injection is very easy to use. It is available in the form of a pen-like auto-injector. The needles are available with the pen. Otherwise, you can use any insulin pen needle for it. The best place to inject Ozempic is in the stomach area. You can also use it on the thigh and upper arm like other insulins. But to avoid bruising and local inflammation, it is better to use it in the abdominal area, at least 2 cm from the umbilical cord. After attaching the needle to the pen, you have to check the airflow to make sure the injection is working properly. Also, check if there is air in the pen, bring it to the first mark, and press the plunger from the bottom up until liquid drops comes out from the needle. Then clean the injection site with an alcohol swab and wait a few seconds for the alcohol to dry. Inject Ozempic directly into the skin at a 90-degree angle and do not hold the skin to inject Ozempic, as this may cause bruising at the injection site. Squeeze the injector until the markings return to the 0 line. Then count to 10 and remove the needle from the skin.
User reviews of Ozempic.
In my experience, and when I ask my patients for their feedback, Ozempic injection has mixed results. It is very effective in controlling diabetes, and it has amazing effects on weight loss. People who have taken it for more than 3 months have lost more than 20 kg of their weight. However, some people have not lost weight yet, but their diabetes is well controlled. Please check the comments of another video where people shared their weight loss results. We'll include the link in the description.
What are side effects of Ozempic injection? How to deal with those side effects?
Some people had to cry because of the side effects, such as nausea, loss of appetite, constipation, flatulence, bloating, and sulfurous belching. But some people felt only mild side effects. There is a list of side effects of Ozempic injection that I mentioned in a separate video. Many people have shared their experiences with the side effects. You should watch these videos to get a better idea of Ozempic side effects. There are many common side effects of Ozempic injection, but you can manage some of them, such as nausea, constipation, gas, or bloating. The side effects of this injection start after taking the first dose of Ozempic, because nausea and constipation occur as early as the second day after the first dose. Some side effects, such as fatigue, dizziness, and weakness, start later as it takes full effect. I have also created a video on how to deal with these common side effects. You check that also. The link is in the description.
What to do after you stop taking Ozempic injection?
If you take this injection for diabetes and stop taking it, your blood sugar may become too high. If you change your dose or stop taking it, you should check your blood sugar carefully. Your doctor can tell you what to do if you have problems controlling your blood sugar. Even if you are using Ozempic for weight loss, you should not stop taking it abruptly, but always follow your doctor's instructions for stopping the injection. When you stop this injection, it takes 4 to 5 weeks for the drug to be eliminated from your body. Until then, you may feel the common side effects. Loss of appetite may last for 2 months because your stomach gets smaller as you lose weight. But what about the weight? Or will it last forever, or can you gain it back? Well, it all depends on your lifestyle. If you stop dieting and start eating more than before, you will regain your former weight. So it is better to keep your diet plan and eat less. The most important thing is the exercise you still need to keep your weight in the normal range.
Watch our next videos for more info about Ozempic injection.
The last but not the least, please subscribe to our channel Pharmacist online. This will encourage us to make more informational videos for you people. Wish you a healthy life.